tell us about your career choice. How do you end up here?
You want the truth, huh?
I want the absolute truth.
Oh my. So I came here as a fellow, after I completed my residency as a training in hematology oncology in 1994. And it was July 1st, 1994, when I'm on the floor in the hospital. I really do not even know where the bathroom is. I do not know where to start, where to begin. And one of the nurses says, "Oh, this is your patient, you go and see him." I didn't really know what the diagnosis was. I'm going into the room and they say, "Oh, you can't go in like that. You have to put a mask, a gown, booties, and gloves to really enter the room." I did get dressed and entered the room, and I said, "So what do you have?" And he says, "I have amyloidosis." I said, "How do you spell that disease?" And he was very sick. I took him through transplant. The gentleman came from New Jersey to undergo treatment with high-dose chemotherapy and stem cell transplantation. And during that rotation of 3 months, he was still in the hospital for 3 months and was extremely sick. His family members, he had 3 children. They were in New Jersey. His wife was a flight attendant and was able to come to visit him only on the weekend. And I thought that was a challenge for me. I thought that was a social challenge, academic challenge, and I took it upon myself, saying that I don't know the disease, I don't know the treatment, but I would make sure that this gentleman gets through. And that is how my career started. I finished my fellowship and stayed here, on staff since 1997. And I think I like challenges, as you have known, and this is a challenging disease, and I've seen many patients undergo this massive, aggressive treatment and get better. And that's how I got involved in this disease and got involved in the career.
And how fortunate your patients are, I must say.
I become part of their family.
Yes, you have.
Yes.
And Dr. Seldin, what about you?
I'm not sure I can top that. I came to Boston University, around when this program was beginning in 1995, and was asked to become a part of it as someone arriving with a background in stem cell transplantation for other diseases. Like Dr. Sanchorawala, I was incredibly intrigued by the disease. I was incredibly rewarded by the responses that our early patients had and the way that they got better. And I developed a stronger and stronger interest over the years and have the privilege to be the third director of what's now the Amyloidosis Center at Boston University. I really follow on the shoulders of giants. Our program was begun by Dr. Alan Cohen, a rheumatologist who started the research side of this in the 1960s. Dr. Skinner took over the program, Martha Skinner, and she really had the foresight to not only to continue to expand the laboratory side of the program, but to reach out to clinicians and to assemble a team to be able to start the treatment components of the program and build a multidisciplinary program. And she is an internationally recognized figure in this disease. She's been president of the International Society of Amyloidosis, and it's really a privilege for all of us to kind of continue the work that she and Dr. Cohen before her began here.
This excerpt is brought to you by the Massachusetts School of Law, the leader of reform in legal education and the leader in multimedia education for the public. To view the full interview and for a full listing of MSL's programs, log on to mslaw.edu.